Hi there, just thought I'd do an update of how my leg recovery is going. It's been a few weeks since I made a video. I'm now 6 weeks post-op today, so about 3 weeks since I last did one. Yeah, it's all progressed quite well. Let me think now. I had to, I think last video I did, we were in the process of doing the 3 week strut turning to get the bones into the right position. That finished a couple of weeks ago, and that all went very well. It became less traumatic as time went on. And then I thought then that was going to be it. That was the final strut turning. But then it then transpired that last Wednesday, when I went back to see my consultant, I was told that we now had to, the bones were all in the right position, had x-rays, long leg x-rays done. I was told that the bones were now in the right position, and that we then had to get the bones touching again, because he wanted me to start putting weight onto my leg. For the next time I see him, he wants me to be on one crutch. Now it's been it has been painful, not, as I said previously, not unbearable, but I am taking codeine regularly, 4 times a day. It's still uncomfortable sleeping at night. I have to sleep on my back, with my leg raised. I do get a lot of swelling still in my foot. And yesterday, for the first time, I've managed to get my trainers on. I went to the hospital last Wednesday, and he did some more x-rays and told me I had a 5-day turning program to get the bones to touch again, because I now had to get the bones to touch again. Even though they're in my position, they have to touch again, put more weight on them, and then that means they should heal as quickly as my bones will heal. When I asked him how long that will take, he wasn't committing to anything. I said, I want to be out of the frame by the end of October, which is a further 3 months away. And he went, like that. So they're not committing. But they did say to me, like on the day of surgery, I was told it'd be 3 months initially. And then on the morning of surgery, I was told I could be in the frame for 3 to 6 months and up to a year if there were complications. And I'm determined to be out of it by the end of October. I don't want to be any longer than that. So I've still had no infection in the wounds and the pin sites. My daughter, who's a nurse, has started doing my dressings at home, because it was so, I was meant to have the district nurses coming out to me. That never happened. I got referred to a surgery where I had to go into a surgery, which was awkward getting to arrange lifts. So in the end, the hospital provides all my dressings and cleaning solutions for the sites, the pin sites. So my daughter just does it at home. Last week I was allowed to have my first shower. 5 weeks since surgery, I was allowed to have my first shower. And yeah, my confidence on, I'm not using the frame at all anymore. My confidence on the crutches has grown, and it actually, since I've had we finished turning the struts again this weekend gone, and I've had to start using one crutch and putting more weight on my leg, it does feel more comfortable using one crutch and putting more weight on the limb than not. It was, Saturday wasn't very nice at all, because all I could feel was the bones sort of like rubbing together like that. It wasn't hurting, but it made me feel a bit sick to think of it. So I literally did nothing. I just sat with my feet up pretty much all day. But like, I'm going back to work 2 days a week, this week, Wednesday and Thursdays, with the view to going back full time at some point when my boss needs me back full time. Which I'm looking forward to. I'm a bit nervous though, because my leg does swell up so much. I'm going to take lots of breaks and rest breaks and that, which we'll work around it. It's not the end of the world. Yeah, there's not much else to report really on it. It's just a question of getting through day to day, trying not to rush, just accepting that it is what it is and just getting on with it. I do get stinging in my leg. Things do feel, but they do feel different. don't feel more stable, not really. It just feels less painful when I put pressure on it. So yeah, so that's as it is. It doesn't look any different to previously. Yes, physiotherapy, I'm doing lots of physio, trying hard with that. That is getting easier. I am able to move my leg better. It feels stronger, and I'm just going to persevere with all of it because there's nothing else I can do really. Yeah, so that's it really. There's not much else going on. Yeah, and that's about it. So what I'll do is as things happen, I will make more videos. It won't be much different really, just the same old really. But if anybody does have questions or asks, wants to ask more about how it's progressed or any specific questions about the treatment, then if you want to ask a question, I'll try and answer it. But yeah, for now that's it. I'll probably give you a few more weeks before I put a video up, and yeah, in the meantime I'm just gonna crack on. Okay then, well, thanks very much for watching. Yeah, speak to you soon. Thank you, bye.